Bon dia a tothom. We're in Barcelona, so I'll start in Catalan. Yeah, indeed, and this is the last session before lunch. Let's talk business before we're all rushing out to fill out our stomach. So usually presentation is made by CEO and someone from the management team, but all of them are busy working on our mission to improve access to care for patients who suffer from cardiovascular diseases in Italy. And please don't judge my presentation harshly. I'm chairman of the board, and this is not my job to do, but I am thrilled to be here and actually to present what we do in Aizoi. And you might think that it's another artificial intelligence company. Actually, Aizoi stands for Applied Innovation for Life. Zoi is life in Greek. And that's our commitment to real-world solutions, which we apply to improve access to healthcare to patients in Italy. And you know that cardiovascular diseases are silent killers, and the traditional healthcare system is centered around hospitals, and they're actually struggling to keep up with the growing demand. And that's what we're actually helping them to do we have already deployed more than several thousand devices across Italy. And we are using a robust cloud platform. What we actually do, we are doing telereporting, teleconsulting, and telemonitoring to cardiovascular disease patients and healthcare providers. So our aim to reduce waiting time and power them with data. And we're already well positioned there. We have a significant share of this market and strong partnership across key market segments. Our innovation is driven by experts in healthcare and technology. Actually, we're currently looking around 3 million to gain more share of the market and actually launch new AI solutions. That's it. Thank you.
Thank you very much, Maxim. You can stay. You have 2 more minutes to answer questions from the jury, if you would like.
Yes, please.
Hello, my name is Tomas Lapinskas. I'm a cardiologist and also director for research and education at University Hospital. My question would be, your business plan or how you work with the healthcare providers, and also do you have any kind of data about the savings, because how you reduce the cost for the healthcare?
That's a really good question. So indeed, with the healthcare provider, so our current model actually that our devices deployed outside of the hospitals. We're still partnering with some hospitals. They're using our cloud platform for digitalizing their internal cardiovascular department. But mostly what we do, we are providing direct-to-patient access to telereporting and working with the nurses organization doing the telemonitoring for patients who are staying out of the hospitals. For hospitals, we're actually not saving times, but we're giving them an opportunity to continue monitoring those patients who are actually already staying out of the hospitals and give them an opportunity to get additional revenue income.
Time for one question. Please make it quick, only 30 seconds.
What is your commercial traction? In terms of customer sales?
This year we expect to have 2.5 million of sales, and we are break-even from the last year. Thank you.
Okay, thank you. Maxim. Next up, Sujit Chakrabarty, founder and CEO of Droobi Smith. Welcome to the stage. 3 minutes, starting now.
Good afternoon, everyone. My name is Sujit Chakrabarty. I'm the founder and CEO of Droobi Smith. It's a leading global AI-led diabetes solution. So what we do is a $1 trillion global problem, right, which is working with patients of diabetes. We take patients from uncontrolled levels to controlled and then subsequently to pre-diabetes levels. And we have done that for tens of thousands of patients globally in the last 3 years. The solution is an AI-powered platform, which includes devices, software application for the patient, a portal for the HCP, expert coaching, which includes psychologists, nutritionists, diabetes educators, and then finally the community element. And currently, we are in the middle of Google for Startups Accelerator to build the next version, including the AI components. What is the AI component? So we are one of the 3 or 4 players globally who are building the digital diabetes twin, which can replicate the glucose profile and predict glucose values into the future. And as you can imagine, that can unlock use cases like precision medication for pharma, predictive risk analytics for insurance, and also adverse event detection for providers. So this is the AI that we are building. The version 1 is already there. We are working with Google for Startups to build the version 2. We also have 2 of the largest patient pool studies on the impact of DTX on diabetes. So 2 of the top 10 studies are ours, where we have worked with patient pool, more than 500 patients, to see substantial reduction in HbA1c as the outcome. And these studies are now at ADA, which have been published. In terms of our go-to-market model, it's very simple B2B2C model. We work with clinic chains, government, providers, payers, and ultimately reach about close to 7,000 patients in this year, 9 months of this year, and about 275 clinics. And for each of our clients, we are delivering substantial financial outcomes, which we can go into detail subsequently. In terms of traction, we are growing at about 2.5 to 3x year on year. So this year, we should be closing at about 1.5 million in terms of revenues. Next year, we are projecting 5 million, out of which 2.3 is already secured from existing contracts. And currently, to drive our AI strategy as well as our market expansion, we are planning to raise 4 million, out of which 1.7 is secured. And we are planning to raise another 2.5, which will take us to Series A in Q1 of 2026. So that's the overall plan. And from a team perspective, a very senior team. So 2 co-founders and a very senior executive team, which is driving it. And with that, I'll stop maybe before the time.
Well, so you still have 2 minutes now for questions. Okay?
I'm Madeline from Bupa. What do you think is your biggest competitive advantage?
So our biggest competitive advantage is our clinical evidence. So we have 2 of the largest studies in this space globally, presented at ADA. And second is the AI capability that we have already built. The digital twin can unlock a lot of predictive risk analytics for an insurer, for example, which can give you the risk of macro and microvascular complications. We are still building this, but in the next 3 quarters, we'll have the version 2. So those 2 are our competitive differentiators. And we already are working with 20+ clients who are seeing the value of this, payers and providers included.
And what are the biggest barriers that you see in your journey going ahead?
I think it's cracking the payer model in multiple markets. So we operate out of Middle East, India, and we are also now exploring whether we should be operating here. So the payer dynamics are very different in each market. So that could be the biggest barrier to solve and scale.
Okay, time's just about up. Thank you very much, Suji.
Thank you.
Yes, thank you. Ozcan.
Yeah, yes.
Ozcan or Ozcan?
Oscan. Yeah, whatever you say. It's okay. Enbiosis, yeah.
Omer Ozcan, CEO and founder of Enbiosis Biotechnology.
Yeah, trust your gut. I don't know what you trust, but I guess gut may be the only point that we might trust in the future, because the bacteria are the responsible for the communication. When there's a problem in the communication, the problem starts. We see every day in our life too. Communication is the base. And this communication problem linked to more than 90% of the diseases, yeah, there are lots of evidences there's a link. We all know that there's a link, but the question here is, so what to do about it? Nutrition is the major factor of affecting the life of this bacteria. And how we use the nutrition is to feed and starve these bacteria and changing their ecosystem and make them to produce required metabolites and chemicals that is essential for our life and solve the problem. Yeah, that food to be medicine because it can be a poison as well. We are speaking about the medicine effect, but people don't care about the poison. So in order to use the food as a medicine, we had a strategy. What we had done is we structured an AI in the gut. The AI is correlate the bacteria and their life and with the health. So we do understand potential disease risk and potential health status. So what we have done is the non-invasive way of the fecal transplant, which is we are shifting the individual's profile to a healthy state. How we do it? We push. How we push it? Finding, the way, optimal diet strategy to change it. That's what we have done. And so far, we spend all our effort and time because it's a strong hypothesis, because what we are saying is claiming is huge. We can solve your problem by the food and convert it to medicine with the precision diet. Yeah, there's a good word, but the problem is how. We have published several studies in prestigious journals, and these are for the irritable bowel syndrome and functional constipation, but we are studying now different types of disease as well, eczema, depression, even eye health, colon cancer, because when you change the gut in a healthy state, in a targeted one, targeted microbiome modulation is the future, and that's what we are doing. It is changing a lot. It's solving the problem. And the process is simple. We need the stool sample to understand, and we need the bacterial DNA data, NGS data, to our system. Then when we get the raw DNA data from the laboratories, we don't have any laboratory, this is just a process. We run the data, and we provide the solution. Solution is the results, your potential risk, and the food scoring system, diet plans, automatic diet plans, recipes, and then finally precision supplements. Either you just buy over the market, or we can also work with companies to develop their own precision supplements. It's a comprehensive. So we do have several different models. At the end of the day, we want to help people, and if we work with the laboratories or hospitals to access the patients, they can license our technology and do their own business, but also practitioners are targets, especially integrative medicine practitioners, or the patients. We work with the B2C companies to reach these patients as well.
Okay, Omer, we're going to have to stop you right there because
you've
used up the 3 minutes. Yeah.
I suppose I'm following the 5 minutes. Okay.
Yeah, it's a little confusing.
Okay.
But
okay,
now we can open the floor to 2 minutes for questions.
Yeah, sure.
Okay?
So how many specimens the patient needs just to have healthy gut?
With the one, we don't understand what's happening, and after 6 weeks of diet program, we change it. But what we recommend is every 6 months to check again if there's any imbalance and capture, and then the modulation back. We do have a follow-up clinical trial after the 6 months and 12 months. Even after 6 months, after we shifted the microbiome, it stays there because we create an intelligence in the system. But after 12 months, we do see some back. So that's why every 6 months to follow up, to rebalance is the case. That's what we are offering to our partners.
Will you do any correlation with some other measures, like from the blood?
It's correlated to almost everything, all the biomarkers, anything that's possible in your health. Yeah, please.
Thijs Schaap, Nober. Can you elaborate on your commercial strategy with the partnerships?
Yeah, I was there, and it's good. Thank you asking. So I can use mine. So the first part is the most 90% of business, the cloud software licensing model. So they can do their lab operation and isolate the DNA and upload the data. We are charging the $50 for per analytics. And then we just charge the 10% of the platform side if they sell extra products over the platform. But the main revenue is coming from the software click fee when they run the data and get the results. But we have also full service in the States, which is we are following the laboratory, etc. But the main business model is here.
Thank you very much, Omer.
Yeah.
Thank you. Next up, Erez Levanon, co-founder and CEO of Equanimity AI. Welcome to the stage.
Hi, I'm Erez, co-founder of Equanimity AI. Imagine living every day of your life with pain. Pain that no one else can see, but it's there. It's there when you stand. It's there when you try to sleep. It's always there. For 23 years, that has been my reality. I went through hell and back. I overcame my pain, but millions are still stuck in this hell, suffering. Steering through chronic pain is very much like trying to navigate through a stormy ocean without anything to guide you. And with 30% of the Western world living with chronic pain, it's costing our economies trillions of dollars in healthcare expenses, lost productivity, and the suffering, so many people suffering. And yet, how do we assess pain? We use those, smiley faces. This cannot grasp the complexity of pain, leading to misdiagnosis, mistreatment, frustration, and again, so much suffering. This is exactly why I co-founded Equanimity AI. We're leveraging the power of AI and wearables to transform pain into something measurable, objective, and truly personalized. Our platform analyzes a multitude of data, starting from biometrics through speech patterns and environmental factors. Now, imagine a new reality where healthcare professionals are empowered by Equanimity AI to make data-driven decisions, to track the outcomes of their patients, and to truly personalize the treatments. This is what we're introducing, our pain compass and our pain map, the tools that pain management has been missing all these years. By giving actionable insights, we're changing the clinical value, the clinical treatment for chronic pain patients. While doing that, we're offering a new financial revenue. We're optimizing revenue, and we're helping clinics drive profitability. Equanimity AI is not just about tracking patients. It's about giving them the voice they need. It's not just about tracking outcomes. It's helping physicians treat and end suffering. Join us in redefining pain management. Thank you very much.
Thank you for your pitch. Thijs Schaap, Nober. Chronic pain is a very heterogeneous disease. What kind of clinics are you targeting initially for as your initial users?
So we're working in the US market, targeting mostly interventional pain clinics who treat MSK pain, neck, back, mostly orthopedic kind of pain. Next phases will be neuropathic pain and then cancer-related pain.
Hi, thank you very much. This is Jordi Ferrer from Droobi Ventures. How does your tool, your solution, change the course of the disease? How can you measure, out of your exam, how can you?
Sure. Great question. So there are great and efficient tools for treating pain. One of the biggest problems that we hear from every pain physician is matching the patient and the tool. You go for a trial and error. Do 20 procedures till you hit something, if you hit it. So our tool gives the pain compass, which I showed earlier. It doesn't give you like a scale of 1 to 10. It shows which domains inside pain needs treatment. Is it more in the physiological, more in the psychological, more in the social? Do you need to address sleep? Do you need to address medications? And then whenever you do something, you have objective outcome measurement, and you can see if you're on the path. When you treat pain, it's like climbing a mountain. You only see it when you reach the top. But this gives, both for the patient and for the physician, a guidance to see that you're on the right course.
Gemma Hernandez from Texam, Parsanitary San Juan de Deo. I would like to ask you, this is a support system, a clinical support system, or a medical device?
This is a decision support system, a support system, yeah.
Okay, thank you very much.
Thank you.
Okay, good. Very good. Short answer, just in time. You got it in. Thank you very much. Round of applause, please, for Erez Levanon. And next up is Eric Alhanco, CEO of Medituner. Welcome to the stage.
Thank you.
3 minutes to present starts now.
Hi, thanks for having me here. My name is Eric Alhanco. I'm the CEO of Medituner. And today I will present how we are changing the care for lung diseases and our digital tool, Asthma Tuner. The first problem that we have addressed is asthma, world's most common chronic disease. The good thing about asthma, however, is that there are very effective medications available. And almost all patients can, in fact, be symptom-free if they are taking the medication correctly. However, today, 50% of the patients do not manage to adjust their medication based on their doctor's instructions in their daily lives, leading to unnecessary symptoms, low quality of life, and high cost for the society. Asthma Tuner was started as a research project at the Karolinska Institute in Stockholm and built on the idea to empower patients to take control of their own disease. Patients use our app and our digital spirometer. And in the app, patients receive instant instructions according to the latest guidelines on how to adjust medication. All data is shared with a healthcare provider for digital treatment. We have a patent that makes us the only app that is actually allowed to provide instant, individualized treatment instructions directly to the patients. This is done through just 3 simple steps that takes less than 15 seconds. First, the patients measure lung function, then answer symptom questions, and then they get an objective feedback of their current asthma control and also a clear indication of how they should adjust medication for optimal treatment. The tool is modular and scalable and sold as a subscription service to healthcare providers. Currently, we have 3 modules used in clinics, one for self-care, one for diagnosis, and one for spirometry, which is a more advanced lung function test. And we had 2 new modules come out in the beginning of next year for other respiratory diseases. The patients really love our app, and we are super proud of our user engagement. 60% of patients come back to the app daily. And last year, we were awarded by 45 European patients' organizations the best digital technology for asthma. We have several publications showing the results in a clinical setting, but it also works in real life. Earlier this year, a report from the largest European implementation of digital asthma care showed improvement in both health economy and patient outcome. For example, 18% on average improvement in lung function, a 25% reduction in primary care visits, and a more than 50% reduction in time spent in consultations. And this result led to that just last month, we were the first app-based medical device to be included in the nationwide reimbursement system in our home market, Sweden. Next steps for us is to develop the tool further, and we are just wrapping up a clinical trial together with Mayo Clinic, where we integrated our tool with an AI prediction system and also commercializing in new markets. Thank you for your attention.
Thank you very much. And now it's time to open the floor for questions from jury members. Under 2 minutes.
Hello, my name is Shola Oyewole. I work for a pulmonary hypertension company in Washington, D.C. Does your device diagnose ILD or COPD?
So one of the two modules that I mentioned that we're releasing early next year is for COPD. But we also, or healthcare professionals use our tool for multiple different diseases, such as long COVID, for diagnosing, for example, work-related asthma and cystic fibrosis, etc. So the spirometry module in our tool are used for any lung disease, really.
So do you have any agreements with healthcare providers? And if yes, what is the business model? Do you charge per patient, per measure?
Thank you. We use a subscription model. So healthcare providers or public healthcare, as example in Sweden, are paying for a yearly subscription model per patient that they are enrolling to our system.
Thank you. This is for medical support or can be performed by the patient alone at home?
It's primarily a self-management device. So it's used by the patient at home, and all the data is shared with the healthcare provider. So you can do remote spirometry, and the healthcare provider can look at the data and instruct you over chat or video or just independently, if you like. So it's used for patients in their home setting.
Thank you very much.
Thank you very much, Eric. Next up, David Blanquez Caurel, CEO of MJN. David.
Hello, I am David Blanquez. I am the CEO of MJN, and this is a personal project because I have a daughter with having epilepsy for more than 20 years. So we moved to this sector because of the family. What we are doing in MJN is a first product that is predicting the epileptic seizures. We are developing a device that is helping the people to improve the quality of life and to prevent accidents and injuries. Epilepsy is 1% of the world's population affected by epilepsy, and we are working with the 30% of them, who is the people that are having drug-resistant epilepsy. It means that they have a drug, they have treatments, but they have still seizures. They need caregivers, they have anxiety, depression, they have a lot of comorbidities that is helping in these persons. In this case, we are working with a device that is wearing the people all the time, and with a mobile phone, we are alerting the people before the onset of the seizure, so they can move to a safe place, they can stay alone, or they can with a caregiver, or make some protocol to prevent the accidents and the injuries. It is marketed in Europe, and we are developing the product for US also. What we are doing is preventing these accidents, sending an alert 1 to 3 minutes before the seizures, so they can execute the protocol that they have. What we are doing is performing this in Europe with a pharma company that is Neurax Pharm, and we are working with them in the 32 countries in Europe, and we are starting the process in US with another pharma company, and also in Mexico and Brazil and other countries like Canada. In all the strategies that we have, we are developing all the technical issues about the regulatory, the technical performance of the device, artificial intelligence, and they are performing all the commercial tasks, promoting, marketing, and sales. We have also a second device that is wearing people with Alzheimer. This is a screening for Alzheimer's disease that we can perform an early diagnostic of the disease, so they can administrate the new drugs to stop the progression of this disease. It is working with EEG and a cognitive test, and we can send the information to the doctors, like a cognitive part, the clinical part of the patient, and the neurophysiological part, what we are seeing in these documents. And we can send some information to the doctor to say which are the risks of these persons to having the disease in the next times. This is our team. We are 12 people working on the company. We have a lot of advisors, not only in medical issues, that is important, but also in lawyers, in financial team, and other issues that we need to scale up the company. We are working mainly with hospitals, all the hospitals that we are working in different clinical trials, but also with some other companies like Medtronic, Neurax Pharm, other companies that are helping the distribution and the manufacturing of the device. We are looking for 4 million euros in Europe to develop the improvement of the device and to bring this device to the FDA to start the clinical trials that we are doing there with diverse people, and also to start the business in US with a pharma company that we are talking with. In the other case, in Alzheimer, what we are developing is the regulatory for the European market that we have started now and we will finish on next year. So we have to develop the business in Europe for the Alzheimer disease.
Okay, David, we're going to have to stop you there and go straight to the questions.
Okay, thank you.
We have less than 2 minutes now for questions.
Hi, Anton from Capricorn Partners. You said you could predict seizures, but could you say a bit more about your specificity and sensitivity on that side?
Yes. In the clinical trial that we are developing now in Spain, UK, and Germany, the accuracy that we have is 80%, and the sensitivity is 70%. Specificity is 97%, but this is not included in the scores because it is what the users are doing. But now the patients are having 0% of sensitivity to 70%. So for them, what we are having is an increase of the quality of life very high.
Gemma from Parsanitary San Juan de Deo, Texam Network. You are going to the American market. Do you have the lead investor is international, is from America, or it's a local one?
We have committed 50% of this investment round, and what we are looking is the lead investor to start all the process with the co-investors that we already have. So we are looking for the lead investor also, and some other investors to co-invest with them.
And you are looking at outside Europe?
Yes, we have some investors in US that we are going to JP Morgan on January, and we have some investors in Europe.
Okay, thank you.
Okay, round of applause for David Blanco.
Thank you.
Jack Francis, founder and CEO of Pogo Digital Healthcare.
Thank you, ma'am. Hi, my name is Jack Francis, founder and managing director at Pogo Digital Healthcare. And when I was 12, my dad suffered quite a severe stroke. One of the many problems we faced as a family was poor information provision from the NHS. We were given a 50-page booklet and told to go home. And this is a problem faced by the over 2 billion people worldwide who suffer from long-term conditions. So we've developed Tailored Talks, which acts as a technology gateway between the patient and the clinician. We have a clinical portal with over 4,000 NHS and charity written and approved slides, and an individual view per patient so the clinical system can track the improvement or changes that the patient's having. We also provide system-wide analytics so clinical decision makers can understand demographic changes within symptom types. We also have a digital patient portal where patients can receive bespoke information on their conditions, which right now are COPD, stroke, lung cancer, and long COVID. We have symptom tracking functionality, and we also have direct support from our charity partners who can pick up the patients when they're out of the healthcare system. This has been developed in partnership with industry experts, including Scottish Government members and CEOs of major charities, and altogether, they've invested over £500,000 into developing this product with us. We've just signed our first license agreement worth £120,000 this year, and we have had the IP valued at £380,000 from our accountants. We currently work with NHS Lothian as our flagship client, and we are slowly expanding across NHS Scotland and England, and we are now looking to the private sector to see how we can improve the lives of patients. We are currently scoping an early partnership agreement with Bupa, and we're currently integrating into Now Patient to access their 65,000 pharmacies across America. We are currently raising £500,000 of seed funding with Scottish Enterprise, our regional investment support bank, offering half of that at a valuation of £2.5 million. We have EIS available, and we welcome active support from any people within the digital healthcare space who can help revolutionize our product. Thank you very much for your time.
Questions for Jack Francis? Here we go. One question.
Hi, can you elaborate a bit more on your business model?
Yeah, sure. So we would sell directly to the healthcare provider, so either a large insurer or a ICB or a public healthcare provider. We would sell a license model based on the number of patients in the area and the amount of pathways they'd like to cover, and then they would be able to distribute this to the patient. So one of the big things in the NHS is healthcare inequalities, and the last thing we want to do is charge patients that couldn't afford our product to use it. So we would always charge the healthcare provider.
Thank you.
Do you have any proof that you improve the quality of life of the patients with your solution?
Yeah, so we did a study on our initial pilot was in long COVID in NHS Scotland, and we showed a reduction of around 20 to 25% in symptom severity across the 6 months that patients were using it. And we also had an increase in self-reported patient outcomes of how they were progressing through the symptoms.
Any more questions? No? You want to wait it out, or?
No, I'm happy to be done there. That was terrifying. Thank you.
Thank you, Jack. Fantastic. Round of applause, Jack Francis. Ana Munoz Farré, CEO and co-founder of Punto Health.
By 2030, hi, okay. By 2030, there will be 78 million cases of dementia worldwide. This means that many of you or your friends and family will be affected in some way or another. In our case, it was my grandpa. Care remains extremely fragmented and reactive, with patients not getting tailored information and carers not knowing what to do. But there's a solution for this. Here is where we come in. Punto is a digital platform for after diagnosis with two main pillars: personalized care plans and support, and increased monitoring and coordination with the healthcare system. We cover all stages, from MCI, which is the super early stage, all the way to advanced dementia. Punto Care is your digital companion in your pocket. It's an app for patients and carers to give all the support they need. On one hand, we have personalized, clinically validated content to answer any questions, give tips, strategies, anything you can imagine. On the other hand, we propose customized care plans that includes cognitive stimulation, physical exercise, and so on, through daily missions to make it fun. And our main goal is for patients to be empowered and proactive with their own condition and remain independent for longer, and to support carers in their day-to-day, especially at home. To connect with the healthcare providers, we have Punto Clinic. Through the app, patients can have a symptom tracker where they can monitor their daily symptoms, and we also have a digital biomarker through speech for cognitive assessment. All of this data is gathered and shared with them through Punto Clinic, and this can be used for remote monitoring, patient selection, and better decision-making. Everything we have done has been co-designed and is constantly validated by healthcare professionals, patients, and caregivers. So from identifying the first need to all of the validations that we're currently doing. We're based in London and Barcelona, so we have validations happening in the two countries. Finally, we are a multidisciplinary team based in the two cities, and we've also been part of really interesting projects like the AD Moonshot Fellowship by the Alzheimer's Drug Discovery Foundation in the US. We also recently closed our first investment round this year, so we're not currently raising. And this will allow us to go to market next year. Our model is B2B, and our three main targets are healthcare providers, insurers, and the pharma industry. Till we find a cure, we want to create a world where if someone gets diagnosed or their loved one gets diagnosed, they think, at least I've got Punto. So supporting this is basically supporting many of the people you know in the future or even now. So if you want to be part of the dementia care revolution, come talk to us at booth 50. Thank you.
You have 2 minutes for questions, if you would like.
Yeah. Hi, thank you very much for the good presentation. I'm curious about this personalization that you mentioned. If you mind explaining a little bit more about it.
Yeah, thanks. This is a great question because I didn't have time. So the care plans that we are, let me go back. Yeah. So how it works right now is someone gets diagnosed and they literally sometimes get a paper check of have a healthy lifestyle, do some cognitive stimulation. Some people have access to day centers where they can go twice a week, for example, and do some exercises, but most of them have the same ones. What we're doing is we're getting all of these evidence-based cognitive stimulation, physical exercise that has been used for years for these patients, and we're taking it to an app. And there's two main aspects that make this really interesting. The first one is that it adapts and learns from each user, from the performance of how they do each exercise, and this way we change the level of difficulty, so that it's not too easy for the MCIs, but it's not too hard for the moderate dementias. On the other hand, it's gamified. We're part of the Serious Games Lab program, which is an accelerator to help us add some gamification aspects, and this makes it more fun and engaging, and they get rewarded and so on. Sorry.
What about the patients with severe dementia? Are they capable to use the app appropriately?
So this is a great question because our user changes as the condition progresses. So after even some mild dementias, but especially moderate to advanced, the user is the main carer, who's usually a spouse or a child, or some have even living carers. So in that case, is that the caregiver uses the app for themselves to help with strategies and cope day to day, and then they can give the daily missions to the patients. But we have a lot of usability testing happening with all ages, all stages, to make sure that this is not an issue.
Thank you very much.